Mouth ulcers are small, painful patches or lumps inside your mouth. The main symptom of a mouth ulcer is a small, painful patch or lump in your mouth. Mouth ulcers usually heal within 2 weeks. To help ease the symptoms, avoid foods that may damage or hurt your mouth like spicy, salty or crunchy food. The main symptom of a mouth ulcer is a small, painful patch or lump in your mouth. Mouth ulcers usually appear inside the mouth, on the cheeks or lips. Ulcers can also appear on the tongue. You may have more than one ulcer at a time and they can change in size. Mouth ulcers are not contagious and should not be confused with cold sores. Cold sores appear on the lips or around the mouth and often begin with a tingling, itching or burning sensation. If you have several mouth ulcers, this can be a symptom of hand, foot and mouth disease, which also causes a rash on the hands and feet, oral lichen planus, which causes a white, lacy pattern inside the cheeks, Crohn's and colic disease, a condition that affects the digestive system, a weakened immune system from having a condition like HIV or lupus. Mouth ulcers usually heal within 2 weeks. To help ease the symptoms, avoid foods that may damage or hurt your mouth like spicy, salty or crunchy food. Mouth ulcers are common and should clear up on their own within a week or 2. But see a GP or dentist if you have a mouth ulcer that lasts longer than 3 weeks. How you can treat mouth ulcers yourself. Mouth ulcers are rarely a sign of anything serious, but may be uncomfortable to live with. They need time to heal and there's no quick fix. Avoiding things that irritate your mouth ulcer should help speed up the healing process, reduce pain, reduce the chance of it returning. Use a soft bristled toothbrush, drink cool drinks through a straw, eat softer foods, get regular dental checkups, eat a healthy, balanced diet. Do not eat very spicy, salty or acidic food. Do not eat rough, crunchy food, such as toast or crisps. Do not drink very hot or acidic drinks, such as fruit juice. Do not use chewing gum. Do not use toothpaste containing sodium lauryl sulfate. A pharmacist can help with mouth ulcers. A pharmacist can recommend a treatment to speed up healing, prevent infection or reduce pain, such as antimicrobial mouthwash, a pain-killing tablet, mouthwash, gel or spray, corticosteroid lozenges, a salt, saline, mouthwash. You can buy these without a prescription, but they may not always work. See a dentist or GP if your mouth ulcer lasts longer than 3 weeks, keeps coming back, grows bigger than usual, or is near the back of your throat, bleeds or becomes more painful and red. This may be a sign of an infection, although most mouth ulcers are harmless. A long-lasting mouth ulcer is sometimes a sign of mouth cancer. It's best to get it checked. Treatment from a dentist or GP. A GP or dentist may prescribe stronger medicine to treat severe, persistent or infected mouth ulcers. Possible treatments include steroid mouth spray or steroid tablets that dissolve in your mouth, painkilling gels, ointments, sprays or tablets, mouthwashes to kill or remove any germs in your mouth. Check if you have a mouth ulcer. Mouth ulcers usually appear inside the mouth, on the cheeks or lips. Ulcers can also appear on the tongue. Credit Dr. PMAARAZZI, Science Photo Library, https://www.sciencephoto.com/media/115960/view. You may have more than one ulcer at a time, and they can change in size. Mouth ulcers are not contagious and should not be confused with cold sores. Cold sores appear on the lips or around the mouth and often begin with a tingling, itching or burning sensation. Causes of mouth ulcers. Most single mouth ulcers are caused by things you can try to avoid, Stitches, biting the inside of your cheek, badly fitting dentures, braces. Rough fillings are sharp tooth cuts or burns while eating or drinking, for example. Hard food or hot drinks are food intolerance or allergy, damaging your gums with a toothbrush or irritating toothpaste, feeling tired. Stressed or anxious, sometimes they're triggered by things you cannot always control, such as hormonal changes, such as during pregnancy or genes. Some families get mouth ulcers more often are vitamin B12 or iron deficiency medicines, including some NSAIDs. Beta blockers or Nicorandil stopping smoking. People may develop mouth ulcers when they first stop smoking. If you have several mouth ulcers, it can be a symptom of hand, foot and mouth disease, which also causes a rash on the hands and feet, oral lichen planus, which causes a white, lacy pattern inside the cheeks, Crohn's disease and celiac disease, conditions that affect the digestive system, a weakened immune system from having a condition like HIV or lupus. How to remove a mouth ulcer. Mouth ulcers are aggravating at best and may be extremely painful. Also called canker sores or aphthous ulcers, mouth ulcers can be triggered by various factors, including stress, illness, or simply biting your cheek. However, there are a few tried and true methods that can get rid of those pesky ulcers in no time. Trying home remedies. Rinse your mouth with a saltwater solution. Mix a teaspoon or 2 of salt with a warm glass of water and let it dissolve. Swish the solution in your mouth from side to side. Then spit it into the sink. Don't swallow the salt solution. 1. Repeat this a few times a day, generally after meals and before you go to bed. Try a baking soda mouth rinse. Baking soda is an alternative to a saline rinse. Dissolve a teaspoon of baking soda in half a cup of warm water. Perform the rinse the same as the saltwater rinse. 2. Rinse with mild mouthwash. Rinse out your mouth to clear out any aggravating bacteria and potentially ease the pain of the sore. Just about any mouthwash will work for this purpose. Swish it morning and night. And maybe after lunch as well. 3. Never swallow mouthwash. In some cases, antiseptics, including mouthwash, can cause or make ulcers worse. If the mouthwash is irritating or painful, stop using it until your mouth ulcer heals. You can also try an alcohol-free mouthwash. 4. Use milk of magnesia. Get milk of magnesia from your grocery store or pharmacy. Gently dab a little bit onto your canker sore several times every day. This can have a soothing effect and promote healing. 5. Dab the sore with hydrogen peroxide. Make a mixture that is half water and half 3% hydrogen peroxide. You only need a small amount. Dip a cotton swab in the solution, and dab it over the sore. 6. Do this once to clean the area. Then dip a fresh swab and hold it to the sore for a few seconds. Try to do this morning and night. Suck on ice chips. Ice can reduce swelling and numb the pain of a canker sore. If you can, use your tongue to hold a chip directly against the sore until it dissolves. 7. Keep ice chips in a coffee thermos or a styrofoam cup to prevent rapid melting, and use them throughout the day. If ice chips are too cold for you, try to at least drink cool water throughout the day. Let it sit in your mouth and gently swish it against your sore before swallowing it. Stay away from acidic and spicy foods. Spicy, acidic, and abrasive foods can irritate the sore. This will cause pain and may delay healing. Eat bland and soft foods to let your ulcer heal. 8. Avoid carbonated drinks, citrus fruits, hard foods like toasted bread, and anything with a lot of salt or spice. Be gentle when you brush your teeth. A toothbrush slipping and scraping your mouth can cause an ulcer, and can definitely make a pre-existing one hurt more. Avoid aggravating your sore by using a toothbrush with soft bristles. And try to avoid touching the sore as well. 9. Get toothpaste for sensitive teeth like Biotine or Sensodyne Pronamal to use until your sore heals. Take over-the-counter pain relievers. If you can't get rid of your mouth ulcer as soon as you'd like, you can at least try to improve your comfort. Take an over-the-counter pain reliever like ibuprofen, or use an OTC numbing gel. These are available at your local pharmacy. 10. If you have any medical conditions or take other medications, talk to the pharmacist or your doctor before choosing a medication. Don't take aspirin if you're under 16. Never give aspirin to a child. Try vitamin supplements. Vitamins B and C may help to heal mouth ulcers, though this needs to be studied further. 11. Get vitamin supplements from your drugstore or pharmacy after speaking with your doctor or pharmacist. Only take the recommended amount. Seeking professional treatment, see your doctor if the sores are large or extremely painful. Most small canker sores heal on their own in a week or 2. You may need medical help if you have multiple ulcers, very large ulcers, your pain is severe, your sores do not heal after 3 weeks or they spread, or you develop a fever. 12. See your doctor or your dentist. There are many medications and treatments that can help. Your doctor or dentist can help you make sure your problem is actually a mouth ulcer, and not a tooth abscess or a rare form of oral cancer. Ask for topical pain medication. You can get some pain medications over the counter, but others require a prescription. It's best to ask your healthcare provider which medication is best for you to use. There are numerous pastes, creams, liquids, and gels on the market that can ease the pain and speed healing of mouth ulcers. Use a product containing one of the following ingredients: 13. Fluosinonide, Lidex, Vanoss, benzocaine, Anbesol, Can-K, Zilactin B, Orabase, hydrogen peroxide, oral antiseptic mouth sore rinse, Peroxil. Request a medicated mouth rinse. If you have multiple ulcers, a mouth rinse may be easier than applying gel to each individual sore. Ask your doctor or dentist about getting a mouth rinse containing dexamethasone or lidocaine. These can both ease pain, and dexamethasone can also reduce inflammation. 14. Take prescribed medication if your sores won't heal. You may need oral medication if your ulcers don't heal with other treatments. Talk to your doctor about your options, and let them know about your health history and any medications you take. Some medicines for other ailments can be used to treat stubborn mouth ulcers, such as sucralfate, carafate, and colchicine. 15. Your doctor may prescribe oral corticosteroids if you have severe ulcers that won't heal. These can have many side effects and are usually a last resort. Alert your doctor if you're pregnant or breastfeeding or if you have an autoimmune disease. You might be better suited to another treatment. Get your ulcers medically cauterized. Your doctor may cauterize your ulcers with a chemical or instrument. This destroys the damaged tissue and may relieve pain and speed healing. Ask your doctor or dentist if this option is right for you. 16. Take a supplement to prevent recurrence. If you're low in any nutrients, your mouth ulcers may return. Talk to your doctor about whether you should take a supplement for folate, vitamin B12, vitamin B6, zinc, or any vitamins. This may help prevent recurring sores. Your doctor can check if you're deficient in any nutrients by taking a blood sample. Mouth ulcer. About mouth ulcers, if you have a dental problem you should, in the first instance, always telephone the dental practice that you normally attend. If you are not registered with any dental practice, then you should read our advice on dental emergencies. Mouth ulcers are painful sores that appear in the mouth. Although they're uncomfortable, they're usually harmless and most clear up by themselves within a week or two. Mouth ulcers are common and can usually be managed at home, without seeing your dentist or GP. What does a mouth ulcer look like? Mouth ulcers are usually round or oval sores that commonly appear inside the mouth on the cheeks, lips, tongue. They can be white, red, yellow or gray in color and swollen. It's possible to have more than one mouth ulcer at a time and they may spread or grow. Mouth ulcers shouldn't be confused with cold sores, which are small blisters that develop on the lips or around the mouth. Cold sores often begin with a tingling, itching or burning sensation around your mouth. When to get professional advice? Pharmacy. First, Scotland. Mouth ulcer treatment from your pharmacy. If you have a mouth ulcer, you can get advice and treatment directly from a pharmacy. Find your local pharmacy on Scotland's service directory. Search for a pharmacy near you. Mouth ulcers can be painful, which can make it uncomfortable to eat, drink or brush your teeth. It's usually safe to treat mouth ulcers at home, although your pharmacist may advise that you see your GP or dentist. If your mouth ulcer has lasted 3 weeks, you keep getting mouth ulcers, your mouth ulcer becomes more painful or red, this could be a sign of a bacterial infection, which may need treatment with antibiotics. Mouth ulcers are also a possible symptom of a viral infection that mainly affects young children, called hand, foot and mouth disease. Speak to your GP or call the NHS 24111 service if you're unsure. Read about the symptoms of hand, foot and mouth disease. How to treat mouth ulcers. Mouth ulcers don't usually need to be treated, because they tend to clear up by themselves within a week or two. However, treatment can help to reduce swelling and ease any discomfort. This may help if you keep getting mouth ulcers, or your mouth ulcer affects eating and drinking. Self-care things you can do to speed up healing include applying a protective paste recommended by your pharmacist, using a soft toothbrush to brush your teeth, using a toothpaste that doesn't contain sodium lauryl sulfate, as this may be irritating, avoiding hard, spicy, salty, acidic or hot food and drink until the ulcer heals, using a straw to drink cool drinks, avoiding things that may be triggering your mouth ulcers. See causes below. Pharmacy medicines. You can get several types of mouth ulcer treatment from a pharmacy. Speak to your pharmacist about the best treatment for you. Options include the following. Antimicrobial mouthwash may speed up healing and prevent infection of the ulcer. Children under 2 shouldn't use this treatment. It also contains chlorhexidine gluconate, which may stain teeth, but this may fade once treatment is finished. Painkillers are available as a mouthwash, lozenge, gel or spray. They can sting on first use and your mouth may feel numb, but this is temporary. Mouthwash can be diluted with water if stinging continues. Children under 12 shouldn't use mouthwash or gel. Mouthwash shouldn't be used for more than 7 days in a row. Corticosteroid lozenges may reduce pain and speed up healing. These are best used as soon as the ulcer appears, but shouldn't be used by children under 12. Medicines from your dentist or GP if necessary. You may be prescribed a course of stronger corticosteroids to help reduce pain and swelling and speed up healing. Corticosteroids are available on prescription as tablets, mouthwash, paste or spray, but are not suitable for children under 12. Is it mouth cancer? In a few cases, a long-lasting mouth ulcer can be a sign of mouth cancer. Ulcers caused by mouth cancer usually appear on or under the tongue, although you can get them in other areas of the mouth. Risk factors for mouth cancer include smoking or using products that contain tobacco, drinking alcohol. Smokers who are also heavy drinkers have a much higher risk compared to the population at large. Infection with the human papilloma virus, HPV, the virus that causes genital warts. It's important to detect mouth cancer as early as possible. If mouth cancer is detected early, the chances of a complete recovery are good. Regular dental checkups are the best way to detect the early signs. What causes mouth ulcers? In many cases, the reason for mouth ulcers is unclear. Most single mouth ulcers are caused by damage to the lining inside of the mouth. For example, accidentally biting the inside of your cheek, or a sharp tooth, poorly fitting dentures, hard food, a defective filling. It's not always clear what causes mouth ulcers that keep returning, but triggers are thought to include stress and anxiety, hormonal changes. Some women develop mouth ulcers during their monthly period eating certain foods, such as chocolate, spicy foods, coffee, peanuts, almonds, strawberries, cheese, tomatoes and wheat flour, toothpaste containing sodium lauryl sulfate. Stopping smoking. When you first stop smoking, you may develop mouth ulcers. Your genes are also thought to have a role. Around 40% of people who keep getting mouth ulcers report that it runs in their family. Medical conditions. Mouth ulcers can sometimes be caused by certain medical conditions, such as viral infections, including the cold sore virus, chickenpox, and hand, foot and mouth disease. Vitamin B12 or iron deficiency. Crohn's disease, a long-term condition that causes inflammation of the lining of the digestive system. Celiac disease, a common digestive condition where a person has an adverse reaction to gluten. Reactive arthritis, the condition that causes inflammation in various places in the body, usually as a reaction to an infection. Weakened immune system, for example, due to hiva lupus. Behçet's disease, a rare and poorly understood condition that also causes swelling of the blood vessels. Medications and treatments. Mouth ulcers can sometimes be caused by certain medications or treatments, such as non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen. Nicorandil, a medication sometimes used to treat angina. Beta blockers, used to treat conditions such as angina. High blood pressure and abnormal heart rhythms, a side effect of chemotherapy or radiotherapy. This is known as mucositis. Can mouth ulcers be prevented? It may not be possible to prevent mouth ulcers, because they're often caused by things you can't control, such as a family history or a medical condition. However, the following may help to reduce your risk of developing mouth ulcers. Avoiding certain foods, such as chocolate, spicy foods, coffee, peanuts, almonds, strawberries, cheese, tomatoes and wheat flour. If they cause you to have an ulcer, not chewing gum, brushing your teeth with a soft bristled brush, which may reduce irritation in your mouth, using toothpaste that doesn't contain sodium lauryl sulfate, reducing stress and anxiety, which may be a trigger for some people. Read more advice on dental health. Causes of mouth ulcers: badly fitting dentures, braces, rough fillings or a sharp tooth, cuts or burns while eating or drinking, for example, hard food or hot drinks, a food intolerance or allergy, damaging your gums with a toothbrush or irritating toothpaste.
The fastest way to get rid of a mouth ulcer is to apply a mix of equal parts water and 3% hydrogen peroxide twice a day. Dab the solution onto the sore with a cotton swab and hold it there for a minute. To clean out bacteria, dissolve 1 to 2 spoonfuls of salt in a glass of warm water and swish it around in your mouth after meals and before bed. Place an ice chip on the sore to relieve pain fast and avoid spicy and citrus foods. Read on for more at-home remedies and professional solutions in case these don't do the trick.
Hi everyone, my name is Whitney and I am a dental hygienist. If you're new here, welcome. If you've been here before, welcome back. Let's talk about canker sores and how to get rid of them. And before we jump in, let me quickly remind you about my website, teethtalkgirl.com. If you're ever looking to learn more about a specific dental topic, I have a search bar where you can easily find what you're looking for. And also my Instagram, @teethtalkgirl. Some of the most common sores to get in your mouth are canker sores, also known as aphthous ulcers. They are painful, round, crater-looking lesions that form inside of your mouth. Although temporary, they can be quite uncomfortable. So what causes canker sores? Stress is a big one. What can't be blamed on stress, right? Stress strains your body from head to toe. It can also make your canker sore flare-ups more frequent. Also, braces can cause canker sores from the repetitive irritation in areas where the brackets are. Trauma, a simple slip of your toothbrush or biting onto a large piece of a sharp chip, for example, can cause injury to your oral mucosa and cause an ulcer to flare up. Acidic foods and drinks. Acidic pH levels can irritate some people's mouths, making them more prone to canker sores. Also, allergies, nutrient deficiencies, hormonal changes, and even celiac disease or Crohn's disease can increase your chance of getting a canker sore. So, what do you do to combat a canker sore? I have 20 different things that you can try. 20 sounds like so much, but don't worry, we'll go fast. Use an over-the-counter gel. Topical oral pain relievers like Aura Gel or over-the-counter products can provide temporary relief. Use a mouth rinse. Pain-relieving mouth rinses or mouthwashes do exist, and you can ask your dentist to prescribe you one. Usually it's called Miracle Mouthwash or Magic Mouthwash, and make sure to avoid over-the-counter mouthwashes that contain alcohol. Avoid those. Use hydrogen peroxide rinse, although it's not recommended to rinse with hydrogen peroxide on an everyday basis. Temporary use can serve to be beneficial when it comes to finding a canker sore remedy. Also, make sure you dilute it with water. A 1-to-1 peroxide to water ratio usually works well. Use a salt rinse. Saltwater rinses are ideal for irritated areas inside of your mouth. They are super soothing on your gums and oral tissues. Warm up some water and add some salt and stir and swish. You can safely use a salt rinse 2 to 3 times per day. Practice good oral hygiene. Overzealous brushing and flossing can irritate areas inside of your mouth, causing irritation that can lead to an ulcer. So this is more of a prevention tip, but similarly, not keeping your mouth clean enough can also raise your risk of infections where ulcers develop as a side effect. So practice good oral hygiene. Vitamin B12 supplements. It's thought that people who are deficient in vitamin B12 may be more prone to developing canker sores. Vitamin B12 is naturally found in foods such as fish, eggs, poultry, and dairy products. Drink chamomile tea. Chamomile tea is specifically known for easing swelling and inflammation, including the discomfort of an oral ulcer. Chamomile compresses. Rather than drinking chamomile tea, you can also use dried chamomile or essential oil from the chamomile plant to serve in a safe compress. Honey, believe it or not, I had to. Honey has been scientifically proven to help relieve oral mucosal ulcers. When applied to the sore, it actually shortens the length of time it takes for your ulcer to heal. However, be careful because it can also lead to cavities if it's sitting on your teeth for too long. Coconut oil. Oil pulling has been around for a while. Some people swear by it, even though there isn't really scientific evidence yet out there to back it up, but it won't hurt to try it. Just please understand that oil pulling does not replace brushing and flossing. Avoid eating very spicy, salty, or acidic foods. Some people tend to get mouth ulcers simply by eating something acidic like an orange. So be aware if you notice that your canker sores tend to pop up when you eat certain foods, and then try to avoid them. Aloe vera. This is frequently used for soothing skin pain associated with burns, right? Sunburn. But it's also safe to use on canker sores inside your mouth. Suck on ice chips. Suck, don't chew. Chewing on ice is bad for your teeth, but holding ice on the ulcer or sucking on ice can create a temporary numbing sensation. Sage mouthwash. Like chamomile, sage is another type of holistic herb that some people claim improves the symptoms of ulcers when used in a mouthwash. Alum powder. You'll find alum with other seasonings at the grocery store. It can be applied directly to oral ulcers to shorten how long they last. Just be prepared for an extremely bitter taste. But if you like bitter, this is for you. Yogurt. Depending on what's causing your canker sores, eating yogurt can help since it contains natural probiotics. Echinacea. This may help to speed up healing of ulcers and wounds. Use it the same way you would chamomile. Apple cider vinegar. Another safe mouthwash alternative is to rinse with apple cider vinegar, which is a natural antimicrobial. Or you can apply it directly to the canker sore with a cotton swab. Zinc lozenges. Some people claim that sucking on a zinc lozenge helps relieve pain that's coming from a canker sore. DGL mouthwash. If you don't mind the taste of black licorice, DGL, deglycerinated licorice, say that 5 times fast, can be activated by your saliva to help heal canker sores. Okay, so there you have it. Those are the 20 at-home remedies for canker sores. And lastly, it's important to know that a typical canker sore will last anywhere from 10 to 14 days until it fully heals. And it can keep reoccurring if the area is constantly irritated, making it difficult, if not impossible, to heal until the irritant is addressed. Although most canker sores will resolve on their own within a couple of weeks, there are situations where you may need to seek out the help from your dentist. For instance, if your ulcer is major and so painful that you're unable to eat, call your dentist, especially if it lasts more than 10 to 14 days. Some dental offices are even equipped with dental laser technology where they can literally zap your ulcer so that it feels better the very same day. So it can't hurt to ask your dentist if they have a laser, especially if none of these other remedies are working. Or you can also ask your dentist for that magic mouthwash prescription. That was the second one on our list. I hope this video helped you. Please like and subscribe if it did. And until next time, peace, love, and teeth.
Hi, welcome back to Dr. O'Donovan Medicine Made Easy. In today's video, we're going to go over how to manage aphthous ulcers. And to do this, I'll be using the NICE guidelines, which were last updated in April of 2021. In this video, we're going to be covering 4 main key topics. First of all, we'll cover what an aphthous ulcer is. We'll then go over potential causes of this. We'll then cover options that you might have for treatment, and finally we'll cover what warning features you need to look out for that might mean you need to be seen by a doctor or a healthcare provider. So first of all, what is an aphthous ulcer? Well, it's a painful, clearly defined, round or oval, shallow ulcer, concentrated usually around the mouth, and it's not associated with diseases anywhere else in the body. They often come back again and again and can start from when you're a child. There are lots of possible reasons for developing mouth ulcers. Single ulcers or recurrent ulcers in the same place may be caused by damage to the mouth, for example biting the cheek, or damage to the mucosa, which is the lining of the mouth, with a toothbrush, sharp tooth or filling. If you get an ulcer again and again, then you may have a genetic predisposition to developing them. However, they can also be caused by oral trauma, anxiety or stress, certain foods such as chocolate, coffee, peanuts and gluten-containing products, stopping smoking, as well as hormonal changes related to the menstrual cycle. In terms of investigations, well, they're generally unnecessary. However, sometimes your doctor or your health provider may want to take some blood tests, including a full blood count, ESR, ferritin, folate, and vitamin B12. These blood tests may be done if an underlying cause or underlying disease is suspected, which could be causing the oral ulcers. So how do you treat mouth ulcers? Well, management of aphthous ulcers includes avoiding precipitating factors such as the triggers I've already mentioned, like coffee, peanuts, chocolate, and the like. So if you know that these trigger your mouth ulcers, you should try and avoid them. If the ulcers are infrequent, mild, and not interfering with your daily activities, for example eating, then treatment may not be needed. If treatment is needed, then first-line treatment is usually a topical corticosteroid such as hydrocortisone or a mucosal tablets. You can also give betamethasone in soluble tablets, and the duration of treatment is decided on a case-by-case basis by your doctor. Other therapies that can be used either alone or in combination include topical anaesthetics such as lidocaine sprays or local pain relief and anti-inflammatory agents such as benzodiazepine or chlorhexidine mouthwash. For people with severe mouth ulcers which keep recurring, and then a short course of steroid tablets called prednisolone can be prescribed. However, the exact form and type of treatment will always be determined by the medical professional who assesses you. In terms of recovery time, well, it varies between individuals. However, most mouth ulcers heal within 10 to 14 days without scarring. This brings me on to the final point of this video, which is what do you need to look out for that might be a warning sign? Well, if you've got a mouth ulcer that has persisted for more than 3 weeks, then you should see your doctor. They'll want to assess the ulcer and take a history off you, because persisting ulcers that go on longer than 3 weeks could be a possible sign of cancer and may need to be reviewed by a specialist for further investigations. I've included loads more information in the links within the description box of the video, so please take time to look at those, and if you've got any questions, please leave a comment in the comment section below. I do try to respond to everybody as best as I can. However, I can't provide individual medical advice for medico-legal reasons, and also this is a medical education channel rather than a clinical advice channel. Finally, if you enjoyed the video and you found it useful, please remember to give the video a thumbs up and subscribe to the channel if you haven't done so already for new videos which are released every Wednesday and every Sunday. Once again, thanks for watching. I hope you found it useful, and until next time, bye.
So you're sitting there, trying to eat your breakfast burrito, but this thing inside your lip hurts every time you take a bite. Then you go for a swig of orange juice, and it stings so much that your eyes start to water. That's life with a canker sore, technically called an aphthous ulcer. Once you have one, you're pretty much stuck with it for the next week or so. But there are some things you can do to try to prevent canker sores in the first place, and there are ways to make them hurt less, and maybe even heal faster. To be clear, we're not talking about cold sores here, the bumps you might get on your lips outside your mouth. Those are caused by a viral infection. Instead, the aphthous ulcers are basically little abrasions inside your mouth. They're often caused by something that irritates a spot, like braces or dentures rubbing against your cheek, or acidic or spicy foods. But there are other factors involved too. Studies have shown that when people are especially stressed, they tend to get more canker sores, possibly because the hormones your body releases when you're stressed can trigger inflammation. And nutritional deficiencies, like if you're not getting enough iron or vitamin B12, can thin the cell layers lining your mouth, leading to more canker sores. And then there are the unlucky folks who have recurrent aphthous stomatitis, or RAS, which basically means that they have extra painful canker sores that keep reappearing. Researchers aren't totally sure why people get RAS, but it might have to do with genetics or higher stress levels. So to try to prevent canker sores, you can avoid spicy foods and be careful with anything sharp or pokey in your mouth like braces. But there's no guarantee that you won't get one anyway. The good news is there are things dentists recommend trying to make a canker sore less painful while it heals. You can buy treatments with a chemical called benzocaine, which interacts with your nerve endings to numb the sore so it doesn't hurt when you chew. You can also rinse your mouth with some diluted hydrogen peroxide, which will burn like the sun, but will kill off bacteria that might infect the canker sore and make it stick around longer. And prescription medications with a steroid called fluocinolone can make the canker sore heal faster and interact with your immune system to bring down swelling. For tougher cases, like RAS, doctors can prescribe stronger meds like other steroids or antibiotics. They come with stronger side effects, but have been shown to reduce the number of canker sores people get and make the ones they do get less painful. So the next time you get one of these annoying, painful things, just remember, there is hope. Thanks for asking, and thanks especially to all of our patrons on Patreon who keep these answers coming. If you'd like to submit questions to be answered, just go to patreon.com/scishow, and don't forget to go to youtube.com/scishow and subscribe.
Remember to subscribe and don't forget to hit the bell icon to never miss an update from First Cry Parenting.
Today's topic is canker sores. Canker sores are small, open, and painful lesions that develop in the mouth. They appear on the soft tissues in your mouth, including the base of your gum, tongue, inside linings of the cheeks, throat, and lips. They are usually white, gray, or yellow in color, with a red border. Also known as aphthous ulcer, canker sores aren't contagious and usually heal within 1 to 2 weeks without treatment. Canker sores are categorized into 3 types. Minor sores are the most common types and measure from 3 to 10 millimeters. Sores last 10 to 14 days without scarring. Major sores have an uneven or irregular border and are larger and deeper than the minor sores. They measure more than 10 millimeters, take weeks to months to heal, and may scar after healing. Herpetiform sores are small ulcers that measure from 2 to 3 millimeters, characterized by a large group of multiple sores. There may be as many as 100 ulcers present at the same time that may merge into a large ulcer. They heal without scarring. Causes. Possible triggers for canker sores are injury to the mouth from vigorous toothbrushing, dental work, sports injury, or an accidental cheek bite, emotional stress, toothpaste and mouth rinses that contain sodium lauryl sulfate, allergy to certain bacteria in the mouth, smoking, a vitamin B12, zinc, folic acid, or iron deficient diet, sensitivity to certain foods such as acidic foods, coffee, chocolate, eggs, and spicy foods, hormones, celiac disease, autoimmune disorder, inflammatory bowel diseases, HIV or AIDS, cold or organ transplant that may weaken or suppress the immune system. Symptoms: a burning, tingling sensation in your mouth, a painful lesion that is white, gray, and yellow with a red border, difficulty speaking, eating, or swallowing. Less common symptoms that may indicate a serious underlying condition may include fever, weight loss, swollen lymph nodes. Diagnosis. Tests are not usually needed to make a diagnosis. Your doctor or dentist can identify them with a visual exam. In cases where canker sores are severe and ongoing, your doctor may request tests to check for further health problems. Treatment. Minor canker sores, which tend to heal on their own, do not require treatment. However, large, persistent, and painful sores often need care. A number of options are available. Mouth rinses containing the steroid dexamethasone for severe canker sore. Your doctor may prescribe this to relieve pain and reduce inflammation. Nutritional supplements may be prescribed if you consume a low amount of important nutrients, such as folic acid, zinc, or vitamin B12. If your canker sores are as a result of a serious health condition, your doctor will have to treat the underlying medical condition. Some active ingredients in the over-the-counter and prescription topical products, such as paste, cream, gels, and liquid, such as benzocaine, fluocinamide, and hydrogen peroxide, may help to relieve pain and speed the healing process. Oral medications may be used for canker sores that do not respond to topical treatments. Some lifestyle changes can also help relieve pain and speed healing. These may include avoiding spicy or acidic foods, applying ice to the canker sore, brushing teeth gently, salt water or baking soda mouth rinse. Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.
A pharmacist can recommend a treatment to speed up healing, prevent infection or reduce pain, such as antimicrobial mouthwash, a pain-killing tablet, mouthwash, gel or spray, corticosteroid lozenges, a salt, saline, mouthwash.
Mouth ulcers, also known as aphthous stomatitis or canker sores, is a common ulcerative inflammatory condition of the oral cavity that typically starts in childhood or adolescence. Most of these ulcers usually resolve without any medical intervention. However, recurrent ulceration will cause persistent pain and discomfort, which will impair the quality of life. So, in this video we are going to look at some common causes of mouth ulcers. Although the exact cause of mouth ulcers is not clearly understood, several factors have found to increase their incidence. Psychological stress is one of those factors. This can be explained by the frequent occurrence of mouth ulcers during exam times. Trauma is another cause for mouth ulcers. Biting of the mucosa and wearing dental appliances such as braces can damage oral mucosa and cause ulcers. Cessation of smoking has also been associated with precipitation or exacerbation of mouth ulcers. Hormonal changes in women also increase the risk of mouth ulcers. This is due to the high progesterone levels during the luteal phase of the menstrual cycle. And these ulcers will temporarily regress during pregnancy. Sensitivity to certain foods, including acidic foods such as strawberries, citrus fruits, and pineapples, tomatoes, mushrooms, and coffee, will also increase the occurrence of mouth ulcers. Other causes include hematinic deficiencies, such as iron deficiency, folate, and vitamin B12 deficiency. Malabsorption and gastrointestinal disorders such as celiac disease, Crohn's disease, pernicious anemia, and dermatitis herpetiformis. Immune deficiencies, including immune suppressive therapy, HIV/AIDS, and neutropenias. Certain medications, including non-steroidal anti-inflammatory drugs, alendronate, nicorandil, and antiviral agents such as aciclovir. Using toothpastes and mouthwash containing sodium lauryl sulfate. And finally, certain infections, including hand, foot, and mouth disease.
Oral ulcerations are lesions in the mouth with loss of surface epithelium. There are several causes of oral ulcers, often indicated by their name. For instance, a traumatic ulceration is an ulcer developed after an injury. Other common types of ulcers include the aphthous ulcer, nonspecific ulcer, traumatic ulcer with stromal eosinophilia, or TUGSE, and herpetic ulceration. Across all types, there is no difference in prevalence by gender, but the general prevalence, location, and age vary by etiology. Typically, an oral ulceration appears as a well-defined, slightly depressed lesion with an erythematous or reddish to yellow center. Sometimes, the yellowish center represents a thick, fibrinopurulent membrane that is a mix of acute inflammation and fibrin. This membrane can be removed by applying pressure. The ulcer may also have an irregular white halo with rolled borders. Although these features are common, other clinical features vary by type. Aphthous ulcers, or canker sores, are the most common mucosal pathosis, found in 20% of adults, with about 80% experiencing these ulcers before age 30. Aphthous ulcers only occur on the unattached oral mucosa, unlike herpetic ulcers or cold sores, which occur on the attached oral mucosa. Most aphthous ulcers are related to stress, as often reported by patients. Yet, some individuals will suffer recurrences, termed recurrent aphthous stomatitis. Researchers believe it may be caused by T-cell dysfunction leading to mucosal breakdown or the presence of microorganisms. A traumatic ulceration is caused by an injury that cuts the epithelial surface below the basal cell layer. Sources of trauma include ill-fitting dentures, hard foods like crusty bread and chips, biting injury, irritation from chemicals in toothpastes or rinses, and burns from hot foods or drinks. It is often associated with an underlying inflammatory response. TUGSE is a subtype defined by the presence of many eosinophils. Although its etiology is presumed to be traumatic, the etiology is most likely multifactorial and has not been entirely elucidated. TUGSEs are typically long-standing ulcerations mimicking oral cancer. Clinically, TUGSEs may present as raised ulcerations with rolled margins that can either be asymptomatic or associated with pain. Ulcers may also be caused by infectious agents, particularly viruses like the herpes simplex virus and fungal infections. Often, oral herpes involves cold sores and ulcers in the face or mouth. More rarely, oral cancers, particularly oral squamous cell carcinoma, may lead to oral ulceration, highlighting the importance of determining the etiology of an ulcer. Diagnosis begins with screening and detection. An oral evaluation includes a detailed medical and dental history, thorough clinical examination, and detailed documentation. It is always important to determine the etiology of an ulcer, since malignant tumors may present with a break in the surface epithelium. History and location may help exclude some causes, like the herpes simplex virus. Yet, a tissue biopsy is often needed to reach a definitive diagnosis. Clinical correlation is often necessary, and pertinent case information should be given to the pathologist when a biopsy sample is submitted. To ensure the most accurate diagnosis, it is best to send specimens to an oral and maxillofacial pathologist. Oral and maxillofacial pathologists are dental specialists with extensive training in diagnosing lesions of the oral cavity. The histopathology of an ulceration may be nonspecific, and the pathologist may not be able to determine the exact etiology. However, a pathologist will be able to determine if the lesion represents a more significant pathologic process, such as those associated with squamous cell carcinoma or deep fungal infection. The prognosis and treatment will vary by ulcer type and stage of identification. If trauma caused the ulceration, it must be identified and removed. After the local irritating factor is removed, the lesion should resolve within 2 weeks. The standard of care is to biopsy an unresolved ulcer after 2 weeks. Other causes of ulcers should be treated accordingly, such as antiviral medications for herpes simplex. Now, as a quick recap, an oral ulceration is a lesion devoid of overlying epithelium. Generally, ulcers appear as well-defined, slightly depressed lesions with an erythematous to yellow center and may vary by etiology. Diagnosis begins with a clinical assessment and can be definitively made after a biopsy of the ulcer and surrounding tissue. Treatment is based on the underlying cause, such as removing the source of trauma. If the ulcer does not resolve itself within 2 weeks, a biopsy must be performed, as a more serious condition, such as oral cancer, may be present.
Hi, I'm Dr. Aarti. I'm a dentist practicing at Pearly White's Dentistry off Sarjapur Road. Mouth ulcers. The most common form of mouth ulcer is called aphthous ulcer. It can be either major big ulcers or minor small ulcers or recurrent, which occurs at periodic intervals. The most common cause of aphthous ulcer is stress, some citrus caustic foods, allergies, underlying B12 and folic acid deficiencies, sharp tooth or fillings could be one of the causes. The treatment includes applying local anesthetic gel for pain relief of the ulcer, supplementing with B12 and folic acid, using mouthwashes with chlorhexidine, and in occasional very severe cases, oral steroid application might be required. There are some other ulcers which are less common, some things like herpetiform ulcers and chickenpox ulcers. These ulcers, they appear as yellowish red blisters or small ulcerations in the mouth. This occurs well before the rashes of chickenpox or herpes appear on the skin. The first lesion to appear is in the oral cavity. So in such cases, if it is accompanied with fever, it is best to take professional help. In very, very rare conditions, ulcers due to HIV and cancerous lesions occur in the oral cavity. These mimic a normal ulcer, so when in doubt, it is always better to take professional help.
Typically, mouth ulcers are caused by trauma. This can be mechanical, knocking your gum with your toothbrush. It can be thermal, the Sunday hot potato or the slice of pizza. The mouth ulcer is caused by damage to the surface gum, which breaks down, and that exposes the sensitive surface below. A mouth ulcer will last on average 7 to 10 days, becoming more sore in the middle period before it improves.
How to get rid of mouth ulcers.